Oh, okay, it's working. Well, good morning, everyone. Thank you very much for taking the time and then joining our seminar this morning to Dr. Max Teplitski's seminar. And as you know, Dr. Teplitski is the Chief Science Officer at the International Fresh Produce Association, where he leads global initiatives in science, technology, supply chain innovation, and sustainability. Before joining IFPA, Dr. Teplitski held key roles at the USDA, National Institute of Food and Agriculture, including acting division director and national program leader. In these roles, he oversaw federal research programs in produce safety, microbiology, and nutrition, areas critical to advancing food systems. But Dr. Teplitski is no stranger to UF, having served as a professor here in the Soil and Water Sciences Department. His research focused on genomics of human pathogens and how they adapt to non-host environments. His contributions have been widely recognized, including over 100 peer-reviewed publications and awards such as J.E. Feely Award in Environmental Microbiology and UFHHMI Distinguished Mentor Award. In addition to his academic and federal roles, Dr. Teplitski has contributed to global discussions as a Fulbright Specialist in Agriculture, U.S. Embassy Science Fellow, and Biotech Outreach Speaker. He has also worked on United Nations and industry advisory panels, shaping policy and innovation in agriculture and food systems. Today, Dr. Teplitski will share his insights on industry priorities and emerging trends in agri-food systems, with a focus on packaging, climate-smart practices, and more. Please join me in welcoming him on the stage.
Thank you. Thank you, Zanette, for this introduction. And so great to be back. Thank you for the invitation. Thank you for this opportunity. If you're wondering what International Fresh Produce Association is, we are a trade association and advocacy organization representing the entire fresh produce supply chain, from seed and fertilizer companies all the way to retailers and food quick serve restaurants. So everybody from Bayer and Corteva all the way to Walmart and McDonald's are members of IFPA. The economic impact of our members is around $300 billion in the US. And as a trade association, we advocate, we lobby for the industry, but we also invest in programs to advance technology, future-proof the industry, not just in the US, but globally. And I'll talk about the industry needs in just a minute, but before we jump in, I just wanted to walk down a memory lane just a few years ago to look at what we learned during the pandemic and how it impacted the industry itself and how we think about the innovation and industry resilience. I think one of the reasons that I'm here is for us to remember what the conversations were during COVID, during the first weeks when all of us had to become experts in public health, and all of us sort of were self-tasked with countering the loudest voices in the media and in other news outlets. And it will continue to be important to talk on behalf of the scientific enterprise and on behalf of what we learned. And there is a way to talk about it without being trapped in circular arguments. And all of you have plenty of your own examples of circular arguments that have been litigated in the court of public opinions so many times. I'm begging you to stay out of them. There are so many things that we can and need to talk about, and it's industry resilience in the face of the changing climate. It's the needs to invest in innovation. It's the need to pass the Farm Bill so that we can reinvest in the ag enterprise. So focus your conversations on those needs and not on the conversations that can elicit the hottest response. So this is one favor that I have to ask, and then communicating better as scientists. And I think another lesson of the pandemic is the fact that the first thing that disappeared from the stores were yoga mats, equipment for podcasting, and virtual reality equipment. And none of us became yogis, well, except for Dr. Oy. But very few of us have careers as podcasters anymore. And VR sort of worked itself out within the first few months. Everybody got so bored with it. But what we learned during the pandemic is that that was the time to reimagine the relationship with food. If you think at all the posts about baking and fridge-scaping and finding innovative recipes, that was one of the lessons of the pandemic. Humans are intimately connected to food, and that was an opportunity to step away and rethink that relationship. So how can we leverage that intimate connection between humans and food to tell the story of food and not rely on others to tell the story of food? And when I talk about the industry needs, to me, they're encapsulated in 7 numbers. Those are 70, 37, 6, 1/3, 242, and 593. So the first number is 70. And 70 is for 70% of Americans who are overweight or obese. It is an epidemic all into itself. But it's also a consequence of a very lopsided food nutrition distribution system that exists in the US and increasingly in other countries around the world. We are feeding the cheapest calories to the communities that need nutrition. It also represents a fundamental disbalance in the investment in research. At NIH, the 5 programs that invest in learning how to treat type 2 diabetes, overweight and obesity, and cardiovascular disease, that NIH extramural budget is the same as the totality of the USDA research budget at NIFA, ARS, ERS, and also the libraries, including capital cost, staff salaries, and the investment that goes into extramural research. I think that's one of the conversations that we need to keep having, because in this case, we know exactly what an ounce of prevention like. It's 5 servings of fruits and vegetables, but the investment is so lopsided that we are forgetting. How do I click out of it? And enter? Thank you. The next number is, so this is fascinating statistics that I just pulled up from Pew. This is the GLP-1 inhibitor sales increase over the last few years in the United States. And the real conversation that is taking place right now is, how will this impact consumption of food? People who are on GLP-1 inhibitors, are they going to focus on healthier options, or are they just going to eat whatever, only in smaller quantities? We don't know, but this is one of the trends that is disrupting food systems. The consumption of nutritious foods and the totality of consumption. And I don't know what the answer is. This is an experiment in progress. But the next number I want to share with you is 37, and it's for 37 million Americans who are overweight, who live in food insecure households. The next number is 6, and it's for 6 million of children that live in food insecure households. 1 in 6 children in this country would go to bed hungry at least once a week. So imagine Philadelphia, San Diego, San Francisco, Seattle, Boston, and Washington, D.C., populated entirely by children. That is how many children go to bed hungry at least once a week in the richest country in the world. So that statistic is staggering to me. And it's not only about availability or cost of food, it's also about the logistics and the distribution of food in food deserts. In the city where I live, Washington, D.C., much of the food is sold through corner stores and in a corner store next to my house has more varieties of cigarettes than it has of fresh fruits and vegetables. That is a logistical challenge that we need to think through as we think about the supply chain of the future, food deserts and the places where nutritious foods can be distributed are limited, but there are fundamentally technical and technological solutions that can bring nutrition to urban and rural food deserts. And these first three numbers, 70, 37, and 6, they're a part of an Venn diagram. It's those who are most food insecure. They're also most likely to be experiencing overweight and obesity. Again, part of it is a consequence of the lopsided food security net, but also a consequence of the distribution system that creates these food deserts. So as we think about the supply chain of the future, how can we get nutrition to the communities they need? And this trend is not only in the United States. It's the same trend that we're seeing in countries like Mexico and Philippines and others, where those who are most nutritionally insecure, those who are the most disadvantaged, they're also experiencing the highest rates of obesity and overweight. The next number I want to share with you is 1/3. And 1/3 is for 30% of food that is lost and wasted in the United States. So that's 150 billion pounds of food that never reaches a stomach. So cross-check that against the 37 million of Americans who are food insecure. How can we fight food loss and food waste, distribute that food to those who need it, decrease the cost of production, decrease the carbon footprint? That's a real challenge. And what's important here is not to think of fighting food loss and food waste as an exercise in dumpster diving, because nobody wants to receive a refuse. When I was at NIFA, I also ran the small business and SBIR program, Small Business Innovation Research. And I've invested into two companies at a time. One was Regrained, who was collecting spent grains from beer production, and they were making them into protein bars. And that was almost a decade ago when they were selected for the funding. And then last year they were on Whole Foods' hottest top 10 list of items from the store. So that's an example of how something that's unwanted, spent grains from breweries, can be scaled up as a nutritional alternative. Side note, 1/3 of the applications to SBIR nutrition program were protein bars. So it's hard to find your new protein bar, but theirs hit. Another program that I invested in was a research at Penn State that was collecting avocado pits, and they were using them for an orange pigment that is stable at the pH from 2 to 12, and also water and fat soluble, which is very different from typical carotenoids that are fat soluble, not very stable on the entire pH range. So there are these opportunities for value add products that exist in what we currently throw away. I also bring up now many examples of companies that are in the field thinking of ways to distribute lost food or unharvested fruits and vegetables from the fields. The question that we'll always get is, well, why doesn't the industry just donate the food? And the reality is that there are two biggest investments during the production. One is at planting, another one at harvest. So oftentimes, for a variety of reasons, food doesn't get harvested because it is a tremendous investment to harvest that food that the industry doesn't have, and they make that decision to let the fields go unharvested. So how can we think through using systems approach, using alternatives to physical labor, different supply chains to get that food from the fields? And these data are also fascinating to me. They are from an entity called Refed. They're one of the biggest advocacies for fighting food loss and food waste. And what you will see here is produce is the food that is lost or wasted the most across all sectors. So up to 70% of leafy greens, for example, are lost or wasted post-farm gate. So that's not even counting what's left in the field. Where food is most commonly lost or wasted, mostly at people's homes, then in farms, then in food service. In retail, the loss is typically minimal. And then if you look specifically at on-farm losses of fresh produce, so where do these occur? And I think this is relevant to a lot of conversations about priorities for research, right? Most of it is left behind, not marketable. And this is not because it's of food safety or plant pathology concerns. It's because there is just no market for that crop. There is, for whatever reasons, there is no buyer for that crop. Either the price is not right or somebody else already supplied enough at the price point where it makes sense for the growers to sell. Left behind, inedible. So this is the products that are the outer leaves, for example, from the romaine harvest, or crops that are inedible for other reasons, like food safety, for example. Left behind, marketable. Again, this is perfectly good prime commodity. They just didn't have labor to pick it. And then biorejections, never harvested due to bad weather, and then never harvested because of plant path issues. It's a minor component of why food loss and waste occurs. Yes. Marketable, not harvested because there's no labor to harvest it. So not marketable is not profitable. Marketable but left behind is there was just no labor in the field. The next number is 242, and it's for 200 million tons of plastic waste that ends up in landfills every year around the world. As a humanity, we addicted ourselves to plastics. And to me, it's the invention of plastics is probably the most significant achievement of the last century. It's a polymer with properties that are just don't exist in any other type of commodity. But one of the reasons that we love plastics is the same reasons why they pollute the planet. They don't degrade. They stay around forever, and that's one of the consequences of our addiction to plastics. But then, if we think about production systems that are plastic-free, what does food safety look like? If we're talking about eliminating plastic mulches in fields, what does it do to pesticide applications, to weed control, to control of soil-borne diseases? What does it do to pre-emergent herbicides? You all can name a million reasons why plastic mulches are critical in crop production. So if they're phased out, what does it look like? PVC pipes. PVC is a forever chemical, but we can't have an irrigation system without PVC. So what does irrigation look like without PVC? And of course, when we talk about packaging, and what does safe food look like without packaging, without plastic packaging, especially for value-add commodities like fresh cut and pre-made salads. And yes, there are a number of places where you can buy perfectly good, safe salads and pre-made foods, including mass retail. But thinking of scaling up unpackaged foods, especially that are ready to eat, is a logistical challenge that we'll talk about in just a minute. But this is a real consequence of our addiction to plastics. And the sixth number that I'm going to leave you with is 593, which is 593 million hectares of new arable land that we will need to find as the planet's population increases. So 593 million hectares. That is all of the arable land right now in United States, India, China, Brazil, Argentina, Australia, Nigeria, and Canada combined. This is how much more land we will need to sustain a population of 9 billion people on this planet. So 70, 37, 6, 1/3, 242, and 593. These are the six numbers that, as an industry, would try to wrestle with. How do we future-proof the industry and address these big global numbers? And all of you are asking yourselves, well, these questions, these numbers, they're so global, so big. How do I wrap my lab of 3 people around them? What can I do? And I want to digress for a minute and just tell you a little story about how we went through a strategic planning exercise right before COVID. We brought in this company called Singularity University. I don't think they're a real university, but they help us think through challenges that will face the industry. And they asked us, well, how would a self-driving car impact your industry? And we're like, we're in a fresh produce business. What does self-driving car have to do anything with what we do? Like the industries that are going to be most impacted are transportation, right? It's the Ubers and the Lyfts that now anybody can get a self-driving car. They said, well, what about insurance business? Self-driving cars are going to be safe. They will negotiate with each other. So there will be fewer accidents, right? So insurance business is going to be impacted. Well, what next? Well, if they're safer driving cars, what about organ transplants? There'll be fewer accidents. Fewer accidents means that there will be fewer organs available for transplantation. So what is going to happen to that entire segment of healthcare providers? And how do we start thinking about organs for transplantation that now come from car accidents? What is the option there? And the reason that it is relevant directly to the food industry is because 70% of caffeinated drinks are purchased at truck stops along freeways. That's where coffee and Red Bull and all the others and sodas are sold just for drivers to stay awake. So if drivers don't need to stay awake anymore, what's going to happen to all these companies that rely on caffeine and dosing drivers to stay awake? And then what would people do with that time in the car if they don't drink caffeine, if they don't have to pay attention? How would they invest their time and their energy during the commute? And it seems like a self-driving car is such a remote issue, not relevant to the food industry. All of it is connected. And as we think about these numbers, how are they connecting with everyday problems and everyday research that you all do in your lab? And another sort of example and a plea that I wanted to make is that, we all came from a reductionist tradition. We all spend so much time studying our favorite gene or even like a few base pairs in the promoter of a favorite gene. And that was fascinating at the time. That was all that we had the tools to do. And now, in this building is a testament to the fact how systems research, how data, how ability to really invest everything we know, everything we can learn into addressing real societal problems could be leveraged. And, these conversations are never easy. When I was at NIFA, we had so many scientists come to us and say, I just want to do my thing. Just give me a small amount of money and I'll do my thing, leave me alone. And you've heard the same conversation. I'm guilty of saying the same things once or twice myself. So how do we disinvest from that myopic thinking and start truly thinking in terms of these numbers that impact the planet and impact what we do every day? And more specifically, I wanted to highlight a few trends that we're tracking and more specific granular industry priorities that we're focusing on. So clearly, sustainability is a big issue, and brands and retailers are responding. And when we talk about brands and retailers, what's important to realize is that there are 4 branches of government, but in the industry there are truly 5. Retailers are trendsetters, and they basically function as the regulator for the industry. Retailers are the translators of the consumer trends, and in many cases, retailers have more sway than FDA and USDA over the industry. So paying attention to industry trends, finding a way to connect with the retailers is something that's very important to advance innovation and to channel it in the right direction. For example, one of our biggest members was a retailer was intent on eliminating certain classes of insecticides. And it took a minute to explain what the world would look like without neonics. And we landed on IPPM, Integrated Pest and Pollinator Management, which is a more thoughtful approach that balances out the need for surgical applications of chemicals that are toxic with the ability to balance out the need for food production. So keep an eye, when global trends make commitments, keep an eye on them, because those commitments a year or 2 down the road will get translated into requests for applications or directionality of the scientific enterprise. And then when we talk about consumer trends, it's so interesting because we all have done consumer research when we ask them various directed questions. Would you pay extra for regeneratively produced? Would you pay extra for whatever trait that we all are working on? And invariably they will say, yes, that sounds good. I'll pay more for whatever. Purple kumquats sound delicious. I will pay more for them. And then we also buy point of sale data. And when we buy point of sale data from the aggregated point of sale data from Nielsen, where we'll land is in every market around the world, consumers are driven by these 3 considerations: quality, price, and perceptions of nutrition. There are, around the world, in every market, those are the only 3 considerations that when consumers are in front of a scanning apparatus, those are the only 3 considerations that they care about. They vary between markets. For example, in China, perceptions of nutrition and quality are higher. In Europe, locally grown, Europe was the only place where locally grown had a bump up, but everywhere else in the world, these are invariable characteristics. So as you think about where you invest, it's quality, price, and nutrition. And obviously, it's perceptions of nutrition. Consumers have no way of ascertaining nutritional value of product. And then, we ask them more broader questions. If it's locally grown, if it's free of pesticides, country of origin, growing method, carbon footprint considerations, plant breeding methods. A certain number of them will say, yes, it matters. But as soon as they are in the privacy of the checkout, it always comes down to price, quality, and perceptions of nutrition. We also looked at whether driving factors are different for different types of commodities. And you can see that fresh fruits, fresh vegetables, fresh meat and poultry, dairy products, frozen, it's quality, price, nutritional value for every food in the market. The only difference is I highlighted in yellow, saving time is a big marketing opportunity for frozen. And then dairy products and frozen food, they get brand identity gives a bump up. So better known brands are more likely to be purchased. And environmental impact, consumers think about it, but then they defer to quality, price, and perceptions of nutrition anyway. So trends to watch. This is a complicated slide, and I'll just highlight some of the key trends that consumers are thinking about. And this is what we also recommend that our members look at. Anytime and anywhere in terms of access to foods. Consumers really want to have it now, which is a departure from what it used to be when we would go to the store and stand in line. Now they want it right now. New value equation. Within the price, quality, and nutrition, what else can they get for the same price? They're not willing to pay more for other attributes, but they want it. So how do you increase flavor profiles? How do you change the attributes of the product without increasing the price? Life stage nutrition is becoming a more important conversation as we're able to better understand human genomics and the relationship, the relationship that we all knew about G by E by M now is applicable to human nutrition, more personalized nutrition, more lifestyle nutrition. And this is the trend that will continue, certainly aided by AI and human genomes. Many of you have your own genome sequenced, saved somewhere on a thumb drive. And then sensory experience. Initially we bred for yield. Yield. And what we came back with is consumers complaining that, well, tomatoes are not tasty. They don't taste like tomatoes. And you can say that for a number of varieties that are, where's my time tracker? How much? Oh, good. But now, again, using AI, using biochemistry and precision breeding, we can invest in the technologies and varieties that are not just sweeter, but have a more complex flavor profile. And this is, frankly, one of the few reasons how we can, as an industry, compete with very salty, very fatty, very sweet foods that consumers desire just because they hit the right parts of Nawaton that connect directly to the addiction centers. And permissible indulgence. So this is fascinating because healthy food is a negative driver of purchase. When any food is marketed as healthy, it's a negative driver. Consumers don't want to buy anything that's labeled as healthy. The way we unpack it is because healthy, if you start thinking the logic chain is healthy medicine bitter. And nobody wants to buy bitter. But if you tell them it'll make you live forever, they love it. So how do we flip this marketing and how do we convert healthy foods into permissible indulgence? I think that's one of the ways to increase consumption of foods that are nutritious, that are healthy, that are interesting, just not medicine-y, tasting, or bitter. A fascinating opportunity there. I don't want to go through the entire block here, but you can look up the strategic themes from a number of sources. But as you think about your research programs, how do they fit with these consumer trends? Because at the end of the day, it's the consumers who are going to decide how to invest and as they think about the quality, the price, and the perceptions of nutrition. So while we're talking about consumer trends, it will be also myopic not to acknowledge the things that are happening around the world. And what we're tracking are basically the two global socioeconomic trends that impact everything around the world. And the two of them are climate change and population changes. And in terms of climate change, you can see this map. I think it's from National Geographic. In green, areas where crop production will be facilitated with the change in climate. In orange is the places where crop production will decrease significantly as the climate changes. You would also notice that the orange areas are the areas that are most densely populated in the world. So you can foresee the consequences to the global stability as the populations increase and the ability to sustain themselves decreases. The second trend we're watching are population trends, and specifically population in China. China is on the downward trajectory in terms of population growth. The consequences of one-child policy is that there is an entire generation of men, about 10 million men, that the population is disbalanced. So one of the consequences of it is the decrease in population growth in China. India has exceeded China as the most populous country in the world. And we anticipate that because of the lack of the social net that was built into the Chinese economy, within the next 10 years, the Chinese economy will crater, creating a massive impact on the global economy as well. So some of the things that are happening in the background that impact how we think about the investment in research and the consequences to the global stability. And the third example is a sort of headline from the Politico, and it was a comment from Rahm Emanuel, who is currently the ambassador to Japan. And his comment was, everybody's just in a pissed off mood. And that is sort of the mood around the world right now in terms of election results. Part of it could be blamed on the measures that were put in place to contain the COVID pandemic, but there are other things driving it, including climate change and including the global changes in population density and redistribution. The conversations about labor and labor availability cannot be divorced from the global population trends, and also the discussion of climate change and its consequences, how it impacts labor availability around the world. So let's sort of zoom out from the global issues that we have truly no control over to some of the things that we can tangibly invest in and think through the potential solutions. So de-risking and diversification of the industry is probably one of the biggest lessons from the COVID pandemic. Supply chains got jammed real quick. We've learned that we're trucking immense amounts of foods throughout the continent. What are the alternatives? What is the supply chain of the future? We're investing quite a bit as an organization in understanding what the supply chain of the future looks like. And I invite you to think about that as well. And one of the primary goals of the supply chain is to distribute food with reasonable shelf life to the consumers first of all, around the country and then around the world. Another consequence of changing climate is the redistribution of agricultural production. Currently, I would say at least 70% of leafy greens in the US are grown into deserts out west. Plus 2 degrees means that clay soils in Yuma will bake into a brick, and Salinas is not going to fare much better. So there are real conversations about moving leafy green and other vegetable productions out of the west into southeast and also areas of Midwest where water is more available. The problem and the opportunity there is that the disease pressures are entirely different. The genotypes that were bred for these 2 deserts out west will not do well in the southeast in the winter, and certainly they will fare very differently in places like Michigan. So how can we start anticipating new breeding needs, new pest control needs in these new areas of production, primarily where water more available and where climate is 2 degrees less. So I think it's a real opportunity to start thinking about how we can rethink how we grow, where we invest. Labor challenges. is number one or number two, however you want to frame it. Um, there will be no more available labor than there exists right now. So what are the opportunities for reducing the labor costs and labor needs? And one picture there is the harvest of green onions, a labor-intensive process. But also another thing that we know is the best vectors of human diseases are other humans. So eliminating labor, especially day laborers, is one of the ways to increase food safety of a lot of operations. But can robotics replace labor entirely? We don't know. The contraption in the upper right corner is a laser weeder. Currently too expensive, but now the opportunity exists to use these weeders to collect data as they go to precisely manage, nutrition and pest control. So once these weeders have more functions than just lasering off the weeds, and they can be better integrated into crop production, now all of a sudden the value proposition is very different. The other example on the bottom right, well, the romaine head, you will see that one of those varieties was bred for a robotic harvest. Instead of having laborers in the field, and this is backbreaking work. So to harvest leafy greens, specifically head lettuce, the workers are in the field at 4 in the morning because that's where the crop is still cool, so it doesn't need to be chilled after the harvest. And as the conveyor belt moves, they have to bend up and down every 45 seconds for 8 hours. So there is nobody who wakes up in the morning dreaming of that job. And finding people to do that work is going to be a never-ending challenge. So let's start thinking about the alternatives for labor use. And I have a picture of a generic robot, but there are other types of robots now. And by the way, the arm is actually something that we're moving away from, because the robotic arm is an example of a thing that people think they can replicate the humans, but it's never fast enough. So there are other contraptions that are functioning as harvesters that don't look like a human arm. Digitization of the industry, we think, is a great opportunity. There is an explosion of interest in AI. Machine learning has penetrated the industry pretty well, so there is no initial resistance to the adoption of AI tool or machine learning tools. So how can we continue to leverage these conversations, and what else can we do with the data? And the question I have is models in equity and models of inequity, and that has to do with the data ownership and data sovereignty. We hear the circular conversations that growers' data means nothing without the models, but then also models don't mean anything without the data. So how do we equitably incentivize growers, owners of the data, to contribute to the models? And that's a wide open question that is ripe for conversation, because there is real value. There is real investment that the growers make in obtaining the data, and they're really disincentivized to just give it up. Food safety is a critical challenge in food production, and it's intimately tied with both the climate change and labor shortage issues. The fewer laborers we have, the less time we have to educate them about the processes. The more laborers we have, the bigger is the disincentive for them to take a day off when they're sick. So, and from a testing point of view, it's a statistical challenge. It's worse than finding a needle in a haystack. So how can we build these thoughtful food safety programs that address a multidimensional systems issue? And rethinking packaging is probably one of the biggest challenges that I'm dealing with right now. So a quick plug, we've secured some funding from USDA. In a few days, we'll announce the availability of funding for researchers to apply for this available funding for alternatives to packaging. And for us, an alternative to packaging is not just a better container. It's providing the totality of benefits that packaging typically provides without the plastic. So something that increases shelf life, reduces spoilage, maintains food safety attributes. We're looking at all of these options that we would like to invest in to make them available to the industry. And this is another great example of consumers, when asked, would you buy a product packaged in sustainable packaging? A lot of consumers indicate that they will pay more for more sustainably packaged product. They're saying they're willing to pay anywhere between 4 and 10% more until they go to the point of sale. So this is another disconnect between the social science research and questionnaires and intent to questionnaires and the actual action of the consumers. They want sustainable packaging. They're not willing to pay for it. Shelf life extension, there are a lot of alternatives right now, but they are tied in consumer acceptance. One of the examples, the Arctic apple, the non-browning variety, both of the apple and the potato. So again, just before this presentation, I looked at the point of sale data to see if there's a premium for gene, in this case, it's a bioengineered crop that doesn't brown. And oddly enough, there is no premium for non-browning bioengineered apples or potatoes. Part of the reason for it is because they don't go into mass retail, they go into food service. So they're sold in bulk, which creates the problem, how do we reinvest in breeding new varieties if there is no premium to generate? As an aside, the only crop that right now generates the premium for bioengineered is pink pineapple, which is directly to retail, has, again, a quality attribute that consumers want. Consumers translate it into nutritional attribute, pink pineapple, and the marketing campaign around the pink pineapple is all about this indulgence, right? It's marketed as a garnish on the alcoholic beverage, or it's something that's an indulgence. So a lot of lessons to learn there in the pink pineapple story, but that's the only one that right now generates a retail premium. And urban agriculture, for a long time, we thought that this is an opportunity to shorten the supply chain and get the fruits and vegetables to the consumers that need them. And we first started with these victory gardens, and the reality is that they don't work. People who need the nutrition the most, they typically work in 2 jobs. They just don't have the time to be putzing around in the community garden 2 blocks down, especially when they have a couple of kids at home and work in 2 jobs. So how can we scale up indoor vertical farming is a fascinating question. All of you are tracking what's happening with CEA and investment. We do see a number of firms that are financially very stable, and typically it's bringing the expertise of both the engineers and the agronomists or horticulturalists in the same facility. Those are the ones who have been successful. It's not just a widget solution, it's also a biological issue, because we need to precisely manipulate the growing conditions to get the varieties that produce the best in CEA. And I'm particularly excited to see that there is a number of researchers that are looking for varieties that are uniquely suited for CEA. The advantage there is that conditions can be manipulated so precisely, and we can really focus on the nutritional properties, on the flavor attributes, and not worry about plants, developing bitter secondary products because of the stress, pest-induced stress, for example. So how can we think about CEA both as a technical and a biological opportunity? And IPPM, of course, we can talk a lot about it, and this is a problem that is ongoing. nutrition is also fascinating, and this is the human nutrition, not plant nutrition. And a lot of consumers are nervous about nutrition associated with plant data is because, one day we read in, Popular Science magazine that garlic cures cancer. Then the next week it's ginger that cures cancer. And then it turns out that neither cure cancer. But then when we look at the totality of data, I don't think that most of the irreproducibility is due to bad science or bad scientific conduct. It's something that we're not accounting for. Is it the interaction between the human genetics and nutritional profiles? Is it the environmental conditions under which these crops were grown and they have a different profile of the secondary products? Or is it the human microbiome that is dependent on the host change in the composition of the product in a way that it's healthful or just okay? And I don't know how much money it will take to untangle this irreproducibility issue, but I think once we figure it out, it will be a big leap in food as medicine. Right now, the best we can say is a diet rich in fruits and vegetables, is helpful to your overall health. But once we can make that real connection between the nutrition, the human genetics, and the microbiome, it will be transformational. And breeding for flavor and nutrition, not just sugar content, is so important because consumers are also turned off by very sugary varieties, and they're finding less and less of a market share. The Biotech 2.0, I already mentioned the pink glow pineapple. Non-browning potato was another example. The new entrants to the market are the purple tomato, which is a variety that actually, it's a regulatory mutation from a snapdragon that allows tomatoes to make its own anthocyanins, a pathway that was normally repressed in the cultivated variety. So they just repress that ability of nightshades to produce purple pigment. They're also delicious. They have extended shelf life. They are available at some of the supermarkets, and they're grown by some of the commercial growers at this point. The salad that I'm eating, these were gene-edited mustards, where the production of this wasabi flavor was disrupted. Pardon me? Yeah, but it's that wasabi flavor, not the bitterness, because bitterness is a separate trait, but the wasabi flavor. And I think there are 16 genes that they've modulated so you can change the wasabi profile of the varieties. So these are gene-edited crops, and of course, the greens were gene-edited. And of course, you heard the recent decision by recent court order to revoke the secure rule. So now from the USDA point of view, gene-edited crops don't exist. So this is the intersection of policy and research that we really need to be engaged on so that proper regulation is in place to allow innovation to reach consumers' shelves. I know you're blinking, but yes, that happened last week. And then also consumer education. We asked consumers, do you understand the term GMO? They said 44% of them said yes. And then only of those, only 10 were willing to purchase them. Then we asked the same consumers, do you understand the term bioengineered? And a third of them said yes, and they're very willing to purchase them. So you see the disconnect because bioengineered and GMO are basically the exact same thing. Bioengineered is the approved label for the GMO product. So consumer education is interesting. And what we're advising breeders is not to focus on the method of breeding, but on the traits. Because in reality, when you start telling consumers, well, conventionally grown, conventionally bred involves EMS mutagenesis and all the other abusive things that we do to plants to change their genetics, consumers all of a sudden are less excited about even conventionally bred varieties. So focus on traits, focus on benefits, focus on quality, nutrition, and value as you educate your friends about modern technologies. And I know I started the presentation by talking about seven numbers, but I only gave you 6. So this is my 7th number. So this number, 1 in what, a trillion? That's how much of the federal budget is invested in agricultural research. So this is another conversation that is ripe for educating our decision makers and those of people that we interact with who say that R&D is expensive. No, it's not. Even if we triple the investment in ag R&D, it's going to be 3 out of a trillion that is invested in ag R&D government-wide. So thank you for your attention, and I promise to our team is that I'll put up this slide because we have summer internships available for undergraduate and graduate students. We're specifically looking for, well, email me. I'll tell you more about because it's federally funded, applicants will have to be US citizens. There are other criteria involved. There's a stipend, and there is a great opportunity to learn about the intersection of policy and agriculture. So we want our students not only be great students, but also great advocates and cheerleaders for the entire industry so that we can move some of those numbers away from where they are. So with that, I'll stop and I don't know, do we have any time for questions?
So Zoomland, you couldn't hear me because I wasn't in the microphone, but we have the room until 1. So if people want to hang out on Zoom and ask questions, we'll be here till 1. In person, you have to use the microphone for Zoom to hear. And Zoom, you can type your questions in the chat and I'll monitor that.
First of all, let's give it a round of applause.
Thank you.
Questions?
Max, you didn't address cost, food costs in the US and elsewhere. Is it changing rapidly?
So I can only speak for fresh produce, and
Okay.
fresh produce costs did not increase since the pandemic. So while other foods have increased, there are seasonal fluctuations, right, based on availability. But if you look at the average cost of fruits and vegetables, they did not increase since the pandemic. Which is also problematic because costs of inputs have increased. But there are other things at play because this is a commodity that's very perishable. Also retailers, many of you don't know, but most retailers love selling fresh produce because this is where they generate the most premium. Center store generates almost no revenue for the retailers. So the pricing is very complicated, but in general, fresh produce did not increase in price.
Hi, Christian Cardenas. I have a question following up on the professor question on cost. I have 2 questions. Number one, how do you see sustainability in this area? And the other one is how you see cost related to the additional expenses, meaning energy, to be able to put crops or whatever they harvest, to put it on freezers and then be sold and send it to retailers and so on and so forth, as well as the containers. You talk a lot about the containers. I work a lot with industry, and one of the main issues that we see is that people like to use or still use wooden pallets. And when you address the issue, why don't you use other type of pallets that are more stronger and will last much longer, and it can go back and forth from your supplier, and you reduce those costs, which are not small at the end when you start adding up. I would like to have your input on that. Thank you.
So on packaging, one of the things that I did, I started the Alliance for Sustainable Packaging for Foods, and Wooden Pallet Association is one of the members of that alliance. So there are a variety of reasons why shippers would prefer one type of packaging over another. And circular economy regs in the EU are interesting. And if we're looking to move away from plastic, wood pallets are an alternative. So in terms of packaging, we want to make sure that there are, and packaging is evolving so rapidly. If you look at the regulations in Europe and Canada and California and Australia, the Venn diagram of bans on packaging is not overlapping. There is nothing in the middle. So Europe banned single-use packaging. That's the primary goal. They want circularity. If you look at Canada, Canada banned plastic packaging, including reusable packaging. And some of these are already set in stone. Others are still flexible. Like in Europe, the packaging waste regulations are finally adopted. Canada, there is an regulatory and legal intervention. So moving parts, but right now it looks like we need to think of entirely outside the box, because there is nothing in the middle of that Venn diagram that says this is the packaging that's allowed all over the world. So wooden pallets are as good as any, non-plastic, reusable, grown, commercially. So sequesters carbon during production. Yes, pest issue potentially, but if treated properly. Packaging is such a complicated issue that it's not just driven by cost. And who's going to pay for sustainability? That's a great question. And the answer that we hear right now is, yes, consumers, are you willing to pay for sustainably grown? Yes. At the point of sale, it doesn't translate. And we see a dichotomy in using organic as an example versus whatever you want to call it, regeneratively, climate smart grown, sustainably grown. What consumers see organic is good for me because it has less pesticides. I'm not eating pesticides. Climate smart regenerative is good for the planet. And remember my slide where everybody's pissed off. Considerations, these community-wide considerations are all of a sudden very low on the priority list. So how do we incentivize is part of the questions that we're working with Dr. Grunewald on, is what other values can growers derive from a crop that is grown using regenerative practices? What else is there that they can market separately? Can they go to these brands that tout themselves as climate smart and say, my kumquats or my turnips were grown with climate smart production practices. As I'm selling you a bucket of kumquats, they also come with these sustainability benefits that can help you meet the commitments. Brands are not going to pay more for that. It's already clear. But can they get better contracting? Can they get priority in being placed on the shelf so that the shelf life is longer and consumers get, yeah, so that's the creative part that we're trying to untangle, because there's just no willingness from consumers in mass to pay more for regeneratively grown.
Thank you. Hi, my name is Stefan. I'm a faculty at the Food and Resource Economics Department. I think it's really great. You mentioned a lot of really important issues. I think we can all agree on the priority of these issues. My question is, how does the regulatory environment could be improved, how to help those issues. Just as you mentioned, I think for food as medicine, my work is in nutrition and health. So for food as medicine, I think the biggest hurdle is to get insurance companies to pay for patients using the insurance to buy produce. And as you mentioned before, if we put the health label on any package, people are willing to pay less. So I think it takes a lot of like enforcement from the regulatory environment to make these parts work together. I mean, I feel like we have enough research, but what are the regulators doing?
Yeah. So, there's the American tradition of regulation and there is the European tradition of, loosely I describe it as European tradition. Bottom up versus top down, directive versus incentive based. The US based tradition has always been incentive based rather than enforcement. And, programs like Double Up Bucks that I'm sure you're familiar with, where consumers get a coupon to purchase twice as much fruits and vegetables, they had great impact. How do we weave that into the entire social safety net? Another example that I can give you is our organization advocated for extension of WIC, Women, Infants, and Children program, where I can't remember exactly the numbers, but $12 a month is what was allocated to a basket for lactating women. So one of the things we did, don't quote me on the exact number, directionally it's correct. So we bought shopping baskets and we filled them with $12 worth of fresh produce, 2 carrots, 2 apples, an onion, a potato, and a clamshell of berries. And we distributed them to the lawmakers as they were getting ready to vote on the WIC extension. And things like that really changed their thinking about, can you feed a child for a month on this basket? So things like that changed the conversation. And the opportunity that we see with this incoming administration, there will be a focus on not every disruptor administration that comes in, there's an opportunity to unthink or rethink certain established notions. And there's certainly going to be a focus on healthy eating through non-traditional approaches. So what opportunities can we offer to the regulators to think about incentivizing consumption, either through private insurers or through Medicare, Medicaid? How can we scale up?
Questions. So a lot of researchers like myself is, do their own research and look for a small amount of fundings and leave me alone.
Don't do it. Yep.
But there's a clear, you see, the gap, the industries. What's your insights in terms of from industry or point of view, how to fill in the gap and what research should, leading towards the direction?
Yeah, and the best advice I can, as somebody who has sat in your seat, trying to plug into bigger questions is probably the best approach. Because one little thing, I spent quite a bit of time focusing on, as a postdoc, I've mapped out a promoter for a gene that sort of had an effect on regulation of the virulence and the pathogen that is fascinating to study, but doesn't really cause a lot of problems. So, how do you move out of that situation and reinvest the same energy and creativity in addressing things that are bigger?
So on Zoom, Clyde Frace asked, can you elaborate more about the connection between labor and climate change?
So to me, there is no connection. These are the two global trends that impact everything else that is happening in the world. Climate change, and I promise you, every war that is taking place right now is fundamentally driven by either climate change or a disbalance in population growth in the needs. So availability of labor, availability of food, availability of fertilizers, availability of ability to sustain itself. Even if you look at, the biggest debate about having children, not having children, set aside that debate and realize that at heart is an issue of demographic population growth. So different entities offer their vision of how to solve it, but these are the biggest drivers of everything that's taking place.
Hi, my name is Lauren. I'm a grad student in the agricultural engineering department. My focus is on CEA. And when you were talking about the GMO versus bioengineering aspects, it reminded me a lot of, I read a lot of papers talking about how consumers say they're less likely to buy because CEA is artificial or unnatural, which that, like the GMO versus bioengineering thing, to me feels like a public education and also a marketing issue. But when you're talking about the differences between what consumers say and how they actually buy, I was wondering your opinion on if the GMO issue is something that actually impacts what they buy, or if that's something that seems more like a consideration.
So in the US, GMO is not a negative driver. In other parts of the world, Europe, a GMO label is a negative driver of purchase. But what we recommend, and we've done a couple of think tank sessions on that, is in educating consumers, focus on the traits that consumers value: price, quality, nutrition. Once we start talking about difference between gene editing and GMO, even people in this room, the eyes will glaze over. Trying to explain it to your next of kin is probably an uphill battle as well. So while you may think it's an opportunity to educate them about the process, all they want to know is, what does it mean to me? And to them, it's price, quality, and nutrition.
Thank you.
All right, thank you.
Tomorrow, Dr. Teplitski will host a student and postdoc, graduate student and postdoctoral researcher meet and greet. It will be at McCarty D, 104445. That's the room number, and it will be at 4:15 p.m. That's the only time you could find, sorry. All right, thank you.